Good evening. I'm psychiatrist Jay Fauver, and welcome to Matters of the Mind. Matters of the Mind is a weekly mental health program where you choose the topic for discussion. So if you have any questions concerning mental health issues that I can answer on the air, you may write me via email at mattersofthemind, all one word, at wfwa.org. That's mattersofthemind at wfwa.org. And if you're able to do so, you may call me by dialing 260-969-2720, or during the program, you may text at 260-969-2730. And if you call or text, all we ask is that you leave us a name and the city from where you are viewing. So let's start tonight's program with an email question that I recently received. It reads, Dear Dr. Fauver, what are you most looking forward to for the future of depression or anxiety treatment? Are there any newer medications that stand out for you? I think over the next few years, we're going to be hearing about a lot of medications that affect this neurotransmitter called glutamate. Glutamate is the accelerator on the gray matter of the brain, the outside part of the brain, the thinking part of the brain. And right now we have a medication that's FDA approved. It's a nasal spray called Spravato nasal spray. It's been out for about 8 years now. Spravato nasal spray is a means by which people can get very rapid relief from depressions. Twice a week treatment for the first month, once a week the second month, and every other week or once a week thereafter. So Spravato was the first of the bunch that got FDA approved for the treatment of depression. And then we have Auvelity. We've had Auvelity available for about 5 years now. Auvelity is a medication that is an oral medication that will also affect glutamate. So again, if you affect glutamate, you're going to get fast relief and rapid onset of action with an antidepressant medication. And we're getting away from the medications that exclusively affect serotonin, norepinephrine, and dopamine. If you think about glutamate as being the accelerator on the brain, GABA is the brake on the brain. So glutamate and GABA in the gray matter of the brain are kind of like a teeter-totter, and they got to be in balance. On the other hand, serotonin, norepinephrine, dopamine, they're coming from the brainstem part of the brain down here. So they're kind of giving advice to glutamate and GABA, whether they should enhance their actions or dampen them down. So norepinephrine, serotonin, and dopamine have their roles as well. People frequently ask me, well, what's the role of psychotherapy, talk therapy? We're always talking about these medications. Well, keep in mind, psychotherapy or talk therapy acts as a GPS for your daily activities. When you go to an unfamiliar city, you're often going to use your GPS, and that little person on that GPS machine is going to be telling you, turn right, turn left, keep going another mile or so. It's giving you direction in an unfamiliar area. That's what psychotherapy does. If you have little experience in a particular stress in your life in which you're enduring, if you don't have coping skills to deal with that stress, psychotherapy is there for the purpose of giving you direction to reach your eventual treatment goal. So as we talk about medications for depression and anxiety, I think there's going to be a lot of emphasis on glutamate. You're going to hear a lot about the psychostimulant medications like psilocybin. Psilocybin, at tiny microdosing, can be helpful for people with severe depression and post-traumatic stress disorder with maybe one dosage. I just saw a recent study showing that one dosage of psilocybin in a controlled environment did give people dramatic relief with suicidal thinking. Now, what psilocybin is doing, it's affecting a chemical in the brain, a particular receptor called serotonin 2A receptors. And if you affect that specific receptor, serotonin 2A receptors, it's one of 14 different receptors for serotonin. But if you affect that simple receptor, you can kind of get the brain out of the funk where if you have depression, it's severe depression with suicidal thought, it's thought that you have a kind of an idling going on in the brain where you can't get out of the idling. What you need to do is get it in gear and get going. But when you have severe depression, you can't get it out of that idling, and you idle with ruminative thoughts, past regrets, you think about suicide. So what do? You address it by stimulating the serotonin 2A receptor very abruptly but very briefly. And in doing so, that's how the psychostimulant medications can be effective for depression and post-traumatic stress disorder. We're hearing the same type of efficacy with some people with medications like LSD, which has been around for 70 years now, at tiny microdosing. My hope in the future for the treatment of depression and anxiety, however, will be that we'll have measurable means of determining if our treatments are working in the everyday population. Okay, in clinical trials, we're getting symptomatic relief, which is great, but I want to see us actually have measurable means of determining if somebody's getting their lives back. Now, we have some functionality scales where we're determining if people are getting back to work, they're socializing, they're enjoying things. That's great. We need to do that, but I think we need to step it up a notch and figure out how much people are able to get their lives back once they get out of severe depression. So I'm hoping that will be the case as well. Thanks for your email. Let's go to our next email question. Our next email question reads, Dear Dr. Farver, with so many medications available, how does a person overcome side effects despite the medication being effective? My goodness, we hear about that not uncommonly. A medication is really working for you, but you're getting side effects from it. The first thing we'll typically do is lower the dosage. We're always trying to idealize or optimize the dosage of a medication. It's not unlike going to an ophthalmologist who's giving you different lens strengths, and you're trying to look at the eye chart and figure out which lens strength on the little lens in front of you works the best. That's what we're often doing with medications, and I'm frequently asking people, if you take a medication at a certain dosage and you're at 50 milligrams, when you increased it to 100 milligrams, did it work any better for you, or did you feel any differently? And if they say, no, I didn't feel it differently, or they say I felt worse going up to the higher dosage, that's kind of a no-brainer. Drop it down a little bit to the lower dosage, because a lower dosage might be more efficacious, might work better than the higher dosage with fewer side effects. So we're always trying to find the lower dosage. Now, we can do genetic testing. Genetic testing won't tell you everything, but it'll give you some clues if somebody's a fast metabolizer, a slow metabolizer. In other words, how quickly do they chew up the medication? So if somebody chews up a medication really quickly, we need to give them a higher dosage. If they're a slow metabolizer and they slowly break down a medication, we need to give them a lower dosage. And we'll see that with genetic testing. So that can help us to some degree. But quite frankly, just talking to people and asking them, how do you feel when you went to the higher dosage versus when you're on the lower dosage? So we're trying to optimize that. A second thing we can do when a medication tends to work really well, but it gives intolerable side effects, is we might try to find a chemical cousin to that particular medication that works in a similar manner in terms of its mechanism of action, but yet doesn't have the same side effects. So we might find a medication that works on serotonin, norepinephrine in such a way that it's working well, but it's causing too many side effects. We might find a chemical cousin to that medication that won't cause the side effects overall. So there are ways to get around it. Rarely do we want to add on another medication to the first medications that's causing side effects, but sometimes you can do that where if somebody, for instance, has diarrhea from one medication, but they feel really good, well, drop the dosage. That's the first thing you're going to do. If you tried another medication that has similar mechanism, but it doesn't work as well, okay, you come back to the medication, you find that dosage, and it's working really well, but doggone it, they're still having diarrhea. What do? You give a small dosage of another medication that also maybe can work for the same kind of symptoms, but it's mildly constipating. So sometimes we'll intentionally pair medication together because they have opposing side effects. Don't like to do that, but sometimes it's necessary. Thanks for your email. Let's go to our next caller. Hello, Judy. Welcome to Matters of the Mind. You want to know what is the difference between PMS and PMDD? A lot of acronyms there. Premenstrual syndromes is PMS. Premenstrual symptoms is often used as that term. Premenstrual symptoms are symptoms that occur in about 4 out of 5, maybe 9 out of 10 menstruating women. And it occurs about 5 days before the periods, month by month. Very predictable. And it can have emotional symptoms such as irritability, depression, sadness. It can have physical symptoms such as bloating, breast tenderness, sometimes headache. And they'll notice them very characteristically for about 4 or 5 days, maybe 7 days before each period. And then once the menstrual flow starts, the symptoms stop. That's PMS. The difference between PMS and PMDD, premenstrual dysphoric disorder, is PMDD. PMDD is functionally impairing. In other words, when you have PMDD, you don't have underlying depression throughout the month. You just have really bad symptoms of PMS those 5 to 7, maybe 14 days before each period. And then once the period starts, you feel better. But during those days of the premenstrual days, you're feeling just terrible. You can't function. You don't get along with other people. You have trouble going to work. You have trouble going to school, perhaps. You have trouble getting things done in your life. That's PMDD. So if PMDD, premenstrual dysphoric disorder, is functionally impairing, premenstrual symptoms are annoying. They're present, but they're not impairing in such a way that you're not able to get stuff done. You might notice them, but you can still get stuff done. The difference being with treatment, PMDD has a couple treatments that got FDA approved, Food and Drug Administration approved, about 25 years ago, called Zoloft, also known as sertraline, and fluoxetine, also known as Prozac. These two medications were FDA approved, where you could take them every day of the month if you wanted, but you could actually take them just on your premenstrual dysphoric disorder day. So if you felt really badly, functionally impairingly badly for 5 or 7 days a month, you could take a medication like sertraline or Zoloft just on those days and go off of the medication when you start your menstrual flow. And many people would say, well, my goodness, Prozac and Zoloft. For depression and anxiety, you have to take those every day for them to even work, and it takes them up to 6 weeks to go to work. Well, with premenstrual dysphoric disorder, it's a little bit different phenomenon, because with premenstrual dysphoric disorder, what you're trying to do is increase serotonin in the brain, and after taking a sertraline dosage or a fluoxetine dosage, within 20 minutes, you're going to get sertraline enhancement in the brain. So you're going to notice a very quick relief with that on the premenstrual dysphoric disorder day. So that's called pulse dosing. Pulse dosing, P-U-L-S-E. Pulse dosing is where you only give the medications on the days where you have the symptoms. Fairly unique phenomenon, but it also tells us that premenstrual dysphoric disorder is different from depression or anxiety that we often treat on a day-to-day basis. Judy, thanks for your call. Let's go to our next text message. It comes from Bailey. Hello, Bailey. You had mentioned that you have a lot of anxiety with random people talking to you in public. You get scared easily by them and yell at them when you have anxiety from strangers in public. I'd wonder, Bailey, about the context behind that. If you're getting overly stimulated from a lot of people in public, okay, that could be a phenomenon where your brain's having a difficult time filtering out extraneous stimuli. So extraneous stimuli are filtered out by this operating center right in the middle of the brain called the thalamus. So when you get all this sensory input coming in, the thalamus is like the central operator that sorts it all out. Some people, for instance, with autism, some people with ADHD will have difficulty filtering all that out, and they have trouble feeling really anxious because their filter isn't working so much, and their central operator just gets overwhelmed. So what we'll often do is first identify what's the issue itself. Now, be aware that when you get in the presence of a lot of people, you don't want to start yelling at them, because that's going to get you in trouble. So be aware of the social consequences of how you react in those situations. Okay, you might need to avoid the situations until you get the underlying issue treated, but you could have autism, you could have ADHD. There's a phenomenon called social anxiety disorder, but the issue usually isn't from overstimulation. With social anxiety disorder, it's where you feel, as the name implies, really anxious in social settings. It's often a self-esteem issue. You're afraid of embarrassing yourself or doing something that you'll later regret. That's social anxiety itself. If you're having difficulty with overstimulation with people and it just comes and goes, that could be a mood disturbance like bipolar disorder, where if you're in a manic state, all the input comes in really, really fast and you can feel readily overwhelmed. So I'm thinking diagnostically, you could have a condition like autism, ADHD, you could have bipolar mania, you could have possibly social anxiety, but with any of those conditions, we're going to treat them entirely differently. But that's where I think it's a good idea for you to get assessed to make sure those conditions get in good control, and hopefully in a small incremental manner, you gradually get out and you're around more and more people as time goes on. Thanks for your text. Let's go to our next text. Hello, Tom from Columbia City. You have a question about adopting a dog, helping with mental health. Yeah, that's a really good idea, Tom. Many people will want to have a means by which they can adopt a dog and thereby not have to pay rent, and they are able to take the dog in public as an emotional support animal. I want to get away from even discussing that. That's a whole different level of need. Many people with post-traumatic stress disorder, many people with autism, in which I mentioned earlier, will need that emotional support animal. But just in general for your mental health, dogs are fantastic because dogs have what we consider a soul. Now, not all animals or insects have souls. A dog has a soul. And when an animal has a soul, it means you have reciprocal back and forth, okay? So the dog will look you in the eyes. A dog, I've heard dogs can understand up to 200 words. I think my dog Winnie can understand 300 or 400 dogs because he's exceptionally smart. But she was adopted from a shelter, and Winnie has been around with me for 7 years. And dogs are fantastic for your mental health. They greet you when you get home. Dogs will be very non-judgmental of you. Dogs will listen to you, and when you're having any difficulties. They will go out and walk with you. They're always willing to play. There's so many advantages with dogs. Now, cats, I've had cats too. Cats, okay, that's a different level of engagement, and I know a lot of cat people versus dog people. They'll have a lot of debates on what's the better pet, but the bottom line is, I think having a shelter animal that has that soul and has that reciprocal back and forth with you can be very helpful for the mental health in general. Now, if you have a mental health condition, such as autism, ADHD, post-traumatic stress disorder, yeah, I think there's some treatment advantages in having an animal, emotional support animal in those cases as well. Thanks for your text, Tom. Let's go to our next email question. Our next email question reads, Dear Dr. Falver, does Red 40 and other artificial colors cause behavioral or mental health problems? Red 40 has been around for decades now, and my understanding is in the United States, Red 40, which is a food coloring, by the way, it's going to be removed from the market in the next year. So Red 40, there's a particular condition we've talked about with the Red 40, the red dye, for about 40 years now, and it's been a debate back and forth, and that has to do with children with attention deficit hyperactivity disorder. If you're a child with ADHD, and you take in a red dye, you might have more difficulty with irritability and emotional meltdowns from taking the red dye. What I tell parents, what I tell adolescents, what I tell young adults is just watch for having difficulties in your mood based on what you're consuming. But for many people, they'll notice that if they eat biscuits or rolls from a certain restaurant, they feel really depressed and fatigued. Okay, that might be a gluten disturbance. So in those cases, be aware of what causes you to react. Red 40 does not seem to cause mental health problems for people who don't already have ADHD, and typically who are not children. But if you're a child with ADHD, the Red 40 dye might be more of an issue for you. Like I said, there's expectation that's going to be taken off the market by the end of this year. But it all comes back to identifying, is it causing a problem when you consume a particular ingredient or not, and try to track, okay, is there any pattern in you're feeling more irritable or having more meltdowns in certain situations. And the same with children. I mean, if you identify a child as having a lot of irritability and anger after consuming some cereal that seems to have some red dye in it, red dye is in foods to make them prettier and make them more appealing. But yeah, that Red 40, it's a petroleum-based dye that unfortunately can have some mental health problems if you already have ADHD. If you don't have ADHD, there's no evidence that it's causing mental health problems, but that's always up for debate as well. Thanks for your call. Let's go to our next text. Hello, Rita from Fort Wayne. You had a text about hearing about one must be off of all psychotropic medications before using psilocybin. You take 4 different medications and would be reluctant to take all to stop all the medications. You have PTSD, depression, and anxiety. We're still trying to identify how this is all going to go down, Rita, because in the clinical trials, as you would expect, in a clinical trial for depression or post-traumatic stress disorder, if you're going to study psilocybin, which is basically mushrooms, a particular part of a mushroom, psilocybin needs to be studied by itself in clinical trials. That's how it was studied. Psilocybin is not close to being FDA approved because there's a lot of debate going back and forth on, okay, what's the protocol? Because you're not going to just get a prescription for psilocybin at your local retail pharmacy and take it home and get on the magic carpet ride in your dining room. It's not going to happen. You're going to have to use psilocybin with close supervision in a clinician's office, and you'll be in there for anywhere between 1 to 4 hours. That's all been discussed right now. But right now, psilocybin is being studied all by itself. Now, once we get it in our hands clinically, we're going to find that we can sometimes use psilocybin with other medications. Where do I predict that psilocybin will give people the most difficulty? It'll be if they're already on a so-called SSRI, because SSRI is selective serotonin reuptake inhibitors. We're talking Celexa, Paxil, Lexapro, Prozac, Zoloft. These are medications that enhance serotonin transmission, okay? So they're flooding the brain with serotonin. When the brain gets flooded with serotonin, you're going to be stimulating 14 different serotonin receptors all over the brain, one of which is serotonin 2A receptors. So if you stimulate serotonin 2A receptors, and then on top of that you use psilocybin, which is powerfully stimulating serotonin 2A receptors, you can get some side effects from serotonin toxicity, which could include such conditions as palpitations, fast heart rate, sweatiness, nausea, headache. So it could cause some side effects when you put them on top of other antidepressant medications. But in the clinical trials, psilocybin typically is being used by itself because the researchers and the Food and Drug Administration are trying to determine, is psilocybin by itself effective in helping with depression, anxiety, post-traumatic stress disorder specifically, or does it need to be used with other medications? We might be a year or two away from determining that. Thanks for your text. Let's go to our next email question. Our next email question reads, Dear Dr. Faulver, what advice would you give someone with ADHD who is working a desk job with little stimulation? I previously worked in a very stimulating restaurant with success, but I am now struggling with a change of pace. Many people, when they have ADHD, they'll gravitate toward very exciting jobs. They will be in jobs where there's a lot of challenges, a lot of new and exciting things going on around them. So many people with ADHD will gravitate toward information technology, computer work. They'll gravitate toward being first responders, firemen. They'll be paramedics. They'll go toward emergency room settings. They'll become law enforcement officers. So they're often gravitating toward areas where there's a lot of stimulation, very quick and exciting and challenging. But when you get a desk job, okay, there's going to be less stress in a lot of different ways, but a desk job will have coming with it accounting, sometimes a lot of paperwork, things that might be kind of dull and mundane. So just in general, not knowing your situation particularly, but just in general, what I'd recommend for people with ADHD, when they're at a desk job, it's kind of boring and mundane in some areas. Number one, what you're already identifying, try to decrease outside distractions. So decrease outside distractions the best you can. I've actually seen some people with ADHD wear headphones and they'll play classical music. Now, classical music can be particularly helpful for ADHD. I've heard a lot of people say that Beethoven is very helpful in being able to help them concentrate and decrease outside distractions. So decrease outside distractions, number one. Number two, try to minimize getting things started but not getting them done. So in other words, you want to prioritize what you need to get done first and foremost, get it done. Then the second thing, get it done. Third thing, get it done. So you want to prioritize what you need to get done, not to get started. Many people with ADHD will have difficulty with vigilance and perseverance. They'll have trouble with identifying what they need to get done, and they'll have trouble persevering to get it completed. So they get a lot of things started, but they don't get things done. So identify what you need to get done and prioritize that and get it done. Another thing that I often identify with people with ADHD is you've got to get enough sleep. A lot of children and adolescents, for instance, with ADHD will find that it's much, much worse when they don't sleep very well. Why do people with ADHD not sleep so well? For one thing, you're on a bit of a different circadian rhythm where you might want to sleep in a little bit more in the morning, but many people with ADHD, in the quietness of the night, in the darkness as the night engulfs them, they'll notice that they want to do a lot of stuff. So they start going to social media, they start scrolling, and be aware that social media, they carry that algorithm. It'll track what you're looking at on social media. So you got to be aware that social media, when you have ADHD, will just capture you, and it'll be a thief of time, where it just takes away so much of your time. With ADHD, that's particularly difficult because with ADHD, you're able to hyper-focus when things are novel, challenging, and interesting for you. So you can be on social media late at night for hours, and the next thing you know, you've lost 2 or 3 hours of sleep, and you need to get up in the morning at a certain time, and you're typically sleep deprived. Many people with ADHD will have that phenomenon occur to them. So I'd recommend decreasing outside distractions, prioritizing, and thirdly, getting enough sleep. Those are 3 things right off the bat that I could advise you to try to help you in a fairly mundane desk job when you have ADHD. Thanks for your email. Let's go to our next caller. Hello, John. Welcome to Matters of the Mind. John, you want to know, does naltrexone help with obsessive thoughts? Obsessive thoughts, when we talk about obsessive compulsive disorder, maybe a little bit. Naltrexone is an opiate receptor blocker. As an opiate receptor blocker, it can be helpful for addictive type of behaviors. It can help with some degree with binge eating and the overthinking about food in your brain. Obsessive thoughts, maybe to some degree, but it's not something that's Food and Drug Administration approved for obsessive thoughts. But if somebody is saying that ever since they've been on naltrexone 50 milligrams, or if they've been on Vivitrol injections for alcohol use disorder, by all means, if they say their obsessive thoughts are less, that's great. I think you could have less obsessive thoughts when it comes to alcohol use because it decreases some of the food noise or the alcohol cravings that frequently will come along with that condition. So we'll hear about naltrexone decreasing the perseverance of the thinking about wanting to drink, and we can use naltrexone either in an oral form or an injectable form to get around that. We're going to be hearing over the course of time about more opiate receptor blockers that might be able to do some similar things. I mentioned the opiate receptor blockers earlier with naltrexone. There's another one by the name of samidorphan. Samidorphan is a chemical analog or a similar kind of chemical to naltrexone. Samidorphan can be used to decrease the likelihood of having weight gain from a medication like olanzapine. So we might be seeing more use with that in the future too. Unfortunately, I'm out of time for this evening. If you have a question that I can answer on the air, you may write me via the internet at Matters the Mind, all one word, at WFWA.org. God willing and PBS willing, I'll be back again next week. You've been watching Matters of the Mind on PBS Fort Wayne. God willing and PBS willing, I'll be back again next week. Thanks for watching. Good night.
The preceding program on PBS Fort Wayne is made possible in part by
Cameron Psychiatry, providing counseling and care for those that may struggle with emotional and behavioral challenges. More information available at CameronHealth.com.